I'm Caroline, a yoga teacher based in Edinburgh with a special interest in menopause.
And hi, I'm Dr. Claire, a GP based in London with also a special interest in the menopause.
Together with the Menopause Sisters, and today we're going to speak about HRT, also known as hormone replacement therapy.
So what is hormone replacement therapy? HRT is a form of estrogen and possibly progesterone that you can take to replace some of those deficient hormones that you have, or the fluctuating levels of hormones that you have in the perimenopause and also in the menopause and postmenopausally. Essentially, it's two main hormones. We have estrogen and we have progesterone. And what we aim to do is we aim to give you low doses of both estrogen and progesterone to replace those deficient hormones. The reason that we're replacing both is that estrogen increases the lining of the womb and progesterone stops it getting too thick. So just like in a normal cycle, we aim to mimic that with HRT. Now, HRT has come on a long way since the days of the WHI trial, which was many years ago, which scared many of us about HRT use, but we know that HRT is much, much safer now. And we give estrogen in the form of a spray, a patch, or a gel, which is applied through the skin. And the reason we apply it through the skin is we know that it's a really safe way to give HRT and estrogen, and there's no increased risk of blood clots or strokes in this way, and it's very safe and effective to give to women who've had a history of migraines and migraines with aura. Now, as we said earlier, if you've still got your uterus, you will need a progesterone. And we know the safest way to give that is in the form of micronized progesterone. And all micronized progesterone means is that it's body identical. So it's the type of progesterone that closely matches and is identical to what you would have produced naturally otherwise. And that is taken as a tablet at night and is also very, very safe. Now, some women choose not to take progesterone as a tablet. They would rather have a coil. And the Mirena coil is a really good option for those with heavy bleeding, for example, in the perimenopause, because it can reduce the heaviness of those bleeds, but it can also provide the progesterone component of your hormone replacement therapy for up to 5 years. So in addition to taking the Mirena coil or using the Mirena coil, you would just need to use estrogen through the skin as a patch, gel, or a spray. We're going to briefly mention testosterone today, aren't we? Because testosterone is almost our third vital hormone. We produce 3 to 4 times the amount of testosterone from our ovaries as we do estrogen. And this level also starts to drop in production from our mid-30s. And it's also a really important hormone to consider in our perimenopausal and menopausal journey, because it can also be very, very effective to help with some of the symptoms such as joint pain and low libido, for example.